Hey girl, hey. Okay, so it's Dr. Tasha and I am back, honey. Oh, y'all, I am so tired. I went to see my Eagles in New Orleans this weekend and it was a situation, honey. It was all the things. I had such a good time. Go Eagles. Congratulations to y'all. Y'all deserve every bit of it. And it was all the things. So, although, it was a long weekend, I was not about to let my girlies down and not post a video. So I thought about something, guys, and I have done so much with vaginitis, and me, I don myself the vaginitis slayer because it's true. The girl kills that vaginitis, dead, gone. I had done a series about vaginitis, but I never actually put it all in one place. And I didn't want to wait to do it in a podcast. I wanted you girlies to have the information. Something was burning in my spirit. Like, somebody needs to hear this. Somebody is out there suffering, and I need to fix this. So let's get into it. Before I start, I do want to say, I don't know if you are a woman, if you love a woman, if you know a woman. Did you guys know that I wrote a manual/book? And it's called A Black Woman's Guide to Surviving Pregnancy, Labor, and Delivery. And it's not really just about pregnancy. It's about so many different things. It's about leading up to the pregnancy, trying to get pregnant, things you should or shouldn't do, things you should or shouldn't participate in, things you should or shouldn't eat, like all the things up until a positive pregnancy test. And then we getting all into that. I'm teaching you how to survive that, what to ask your doctors about, what tests you should have, what do all these different conditions mean, what supplements you should be taking. Girl, I mean, step by step by step until we go into the hospital. Then I'm teaching you, okay, if everything is good, let's keep it cute, let's keep it Gucci. But if things go to the left, I teach you what to do. I teach you what to say. And at the end of the day, it all rounds out with me telling you you need legal counsel at your bedside. Yes. So that's one of the things we want to do in these pregnancies these days, ladies. We don't just want to go and be having all these pregnancy photo shoots and all that. Save $400-500 of them dollars to put an attorney on retainer. So when something goes to the left on labor and delivery, you can make that phone call and be like, I'm going to need you right now. Because whether you knew it or not, here in, I don't know what happens out in the outskirts, but in Atlanta, they will change the medical records on you in a minute. And they be like, that never happened. And what you gonna do? What you gonna say? So run out. It's on drtasharogers.com. Get the book. When I tell you pearls, you don't want to go through a pregnancy, an attempted pregnancy, trying to get pregnant. You don't want to go through this journey without this book. I promise you. And I'm not just saying because I wrote it. I snapped 7,000 plus deliveries with no fatalities. Glory be to God. He's the one, not me. But it's in there, girls. The information is in there. Now, okay, let's get into it. Vaginitis. Now, first and foremost, let me say this, because one thing I don't like people squabbling in the comments, and I don't squabble with you. I'll just ignore you and keep on going. But the way that I kind of do things is eat the meat and throw away the bones, okay? If something does not work for you, you don't agree, sweetie, you don't have to. You don't want to do it, that's fine. It's your vagina. It's not mine. It's not anybody. Everybody gets their own. Rock with it and do whatever with it, what you want to. It's okay. I give you the information. Like I said, there's not one patient in my practice who says, I just keep getting this vaginitis and it just won't go away. There's not one. Anybody in my practice who repetitively gets it, they know why. They know why. We've had the conversation. They know why. They're just not ready to make the changes. There are some changes that come with it, and they're not ready to make those changes. All right. So, in that being said, I'm going to break down vaginitis for you from the rooter to the tutor, baby. You will know exactly what to do, exactly what to say to your doctor, exactly what tests to ask for, and exactly how to fix yourself. Okay. So get a pen. I'll wait, sis. I'll give you a minute. Get a pen. Okay. Take your time. It's no rush. I'm just sitting here relaxing. Okay. So first and foremost, I want to bust y'all down on something now. I'm gonna take my glasses off. I got the little Ray-Ban routes on. Y'all see me, right? Anyway, I want to take some time to discuss a little bit about anyway, so vaginitis, like I said, it's my jam. But I would see, like, if 10 black women would come and see me, 8 of them would either say they were suffering with vaginitis or they would have vaginitis currently. And if I would see like 10 white girls, one of them would have vaginitis, right? And I'm like, what is happening? So my mind, y'all know I got this analytical mind. That's where Clean and Cute comes from. My mind started wondering, like, why is it that black women are suffering from this and white women are not, right? And so I got to researching, got to the computer, got to researching, right? And y'all ain't gonna believe this. And so with the research, I'm pulling up stuff, and I know you guys, in order to truly understand how to search Google, you really kind of got to have some like medical knowledge, a little bit, right? So I'm looking all around and I'm like, I've come up on this study from the National Institute of Health. And so basically the study breaks down vaginitis and why black women are more susceptible. I wish I would have remembered the title or remembered to look up the title before. But if you look up National Institute of Health, black women, vaginitis, it should come up. But it's the National Institute of Health. And basically they did this huge study. It had like, and if you know anything about clinical studies, it had like 3,000 or 4,000 women in it. They did it in sub-Saharan Africa. They did it over here. White women, black women, and they looked up, obesity was a factor, socioeconomics was a factor, sexuality was a factor. Like when I tell you they looked at everything, they dove deep into this. And they came up with the reason why more black women suffer from vaginitis. Now, more surprising to me than the reason was the fact that they put it out, but they didn't discuss it. They did not make a big deal of it. They did not even make us aware of it. Can I tell you, I sent this study to 3 of my friends who are OBGYNs. Nobody had ever seen this study. And they were like, And I sent it to one of my friends who's infectious disease. And she was like, So a credible study that gave information that would have helped. Okay. So I was about 3 months ago, years old when I learned about this study. That's how, didn't know. They didn't discuss it. But what they did, they found out that in the vagina, you guys know that y'all always talking about this pH stuff. We don't really learn things in GYN in the spirit of like pH, but since Summer's Eve got y'all all wrapped up in a damn pH, now we got to talk about damn pH, but whatever. So the point is that there are a lot of, you guys hear about the pH balance and the good bacteria and the bad bacteria. So when it comes to black women, there is a particular bacteria called Lactobacillus iners, INERS. And for whatever reason, they don't know, black women's vaginal environment is higher in Lactobacillus iners. And what the conclusion was is Lactobacillus iners makes you susceptible to having recurrent vaginitis. And so what their thought is if you have Lactobacillus iners, or basically let's break it down, if you're black, your vaginitis should be treated with clindamycin and not metronidazole, which I do anyway. I don't use metronidazole, and I will talk to you about that momentarily, about why I don't use it. So the thing is that, but 99% of gynecologists do, even my colleagues, they use Metrogel, metronidazole, that little powder stuff you put on pudding. They use that stuff and it doesn't work. Well, it doesn't work well. Let me say that. And so one of the reasons for my success is that I don't use it. But let's get into it. I'm going to give you the ins and outs of vaginitis, okay? So first and foremost, when it comes to vaginitis, the easiest way to treat vaginitis is to prevent getting it. It's to prevent it, girl. Now, I have come up with the blueprint and how to prevent vaginitis. Take it or leave it. Take it or leave it. But it works. Okay? Now, vaginitis, it is not a sexually transmitted disease. It is sexually associated, and we'll get into that. But it is not sexually transmitted. Okay? There are 7, count them, 7 different types of vaginitis. All right? And yes, you can pick up vaginitis from oral sex. If somebody got the yuck mouth, the bacteria in his mouth can jack up your pH balance in your vagina and you're hemmed up. Oftentimes that's Prevotella. Prevotella is one of the types of vaginitis. But I don't want to lose you, so I'm going to have the conversation with you that I have with my patients so that you guys will fully understand vaginitis. When it comes to vaginitis, again, there are 7 different types. Most doctors' offices only check for 2 to 3 types at the most. You'll get an ambitious doctor who checks for 4. Yes, I do check for all 7. In my practice, we check for 7 types of vaginitis, 5 types of yeast, and 3 STDs, which are gonorrhea, chlamydia, trichomonas. We also check for cervical infections, mycoplasma, and ureaplasma. Then the 5 different types of yeast and 7 different types of vaginitis. Okay? Now, but again, most doctors' offices only check for about 3, maybe 4 at most, but usually they check for 3 different types. And metronidazole only kills 4 types of vaginitis. So let's get the math together. It's 7 types. You're not even getting tested for all the 7 types, and you're not even getting treated for all the 7 types. So the question becomes, are you having recurrent vaginitis, or did you never get treated for the actual vaginitis you had? Because you can have more than one type. I have some people who have all 7 types. I have some people who might have 1 type. I have some people who have 3 or 4 types. So you might have 1 type that metronidazole does not treat. You're still going to have vaginitis. So I don't even waste my time with it. Why would I give you something to take a test, to have you take something for 7 days and then call you and say, oh, the antibiotic I gave you didn't treat the type of vaginitis you have. Take a whole nother antibiotic. Why wouldn't I just start with the antibiotic that treats all 7 types? That's what I do. That's why I have success. I know a lot of people, I hear a lot of times, antibiotics are bad, antibiotics are bad. Antibiotics are not bad. Misuse of antibiotics are bad. Let me be clear on that. An antibiotic will save your damn life. You get sepsis, you'll love to see that nurse running into that room with that bag of antibiotics. Don't play yourself. Antibiotics are not bad. Misuse and overuse of antibiotics are bad. Because what do you guys do? You know what the symptoms of vaginitis are. You get so damn frustrated going in, paying money, doing this, waiting. I get it. So you just call and say, I got BV. Can y'all send over some meds? Well, first of all, who's to say it is that you actually have BV? Stop self-diagnosing. And third and foremost, at what point does it click to you? I keep taking this same medication and I keep having the same problem. What is happening? Like, do y'all ever go to the doctor with questions? Because I know as a Black female, oftentimes other Black females roll up on me and be like, looking at me like, you better get it right. But do y'all go in these other doctor's offices like this? Because I would be aggressive. I wouldn't even be assertive. I would be aggressive 2 or 3 rounds into the same antibiotic, and I'm having the same problem. Somebody got to tell me something, because 1 + 1 ain't equaling 2. And the math is always go math. Okay, so one of the number 1 causes of recurrent vaginitis is poor diagnosis and poor treatment. Okay, like I said, I will hand my patients and hit all the types of vaginitis. You have mobiluncus, you have BVAB2, you have Prevotella. Oh yeah, I let some. This is what you got right here. So, not that it matters the type, because like I said, clindamycin is going to knock all 7 of them out. But again, you don't want to overdiagnose. Stop thinking every time you smell something is BV. That's y'all's issue, because y'all are self-diagnosing, and then you pick doctors who don't care and they don't give a damn what. Oh, you want a prescription? Here you go. And so you're over-medicating yourself, and then the antibiotics are the problem? No. If you don't feel like you're getting appropriate care, where you're going, go somewhere else. But what do they say about doing the same thing the same way and expecting different results? I ain't say it. We listen, we don't judge. I judge a little bit, but we listen, we don't judge. Okay, so there's that as far as treatment is concerned. No, I don't use that other stuff. I use one antibiotic. It's clindamycin. It knocks everything out, and it is what it is. If it bothers your stomach, there's a cream. We got something for everybody, okay? Now, the next thing, which is where I'm going to lose some of y'all. I'm going to lose some of y'all. Y'all going to be like, I can't. Y'all are addicted to the foolishness. I respect it. I don't judge you, sis. You will be back next month with the same problem, but I don't judge you. It's hygiene, but it's over hygiene. Y'all be doing too much. What do y'all think? It's a vagina. Okay. First and foremost, let me be clear. And I break it down to my patients like this. If you had an abscess in your mouth and your jaw is sitting out here, is there anything on the aisle that you can go and get at one of these big box stores like your Targets or your Walmarts? Is there anything that you can go on the aisle, not behind a pharmacy counter, on the aisle to get and fix that? If you had an infection and your C-section scar and it's oozing green, you going to the feminine aisle at Target or Walmart, CVS, Walgreens. If you get some kind of bug bite and it's all big and swollen and oozing and red and might be MRSA and all kind, are you going to the aisle? Okay, so you have something as complex as a whole vagina, but what can fix you is on the aisle? I don't be under, the math don't be math then. Let me be very clear. Half of the things that you all are using to fix your hygiene is causing your vaginitis. I don't, again, blame you, because here's the predicament that I know that most of you guys are in. You notice that there's an odor. You go to get the odor fixed. You do what the doctor tells you to do. You take the antibiotic. 2 or 3 weeks later, you got the odor again. You don't want to be smelling. You don't want to have back wind. You don't want to leave your behind in nobody's bathroom when you go get your nails done or your lashes or whatever it is you get done, or Lord knows at work, and people just are whispering and talking about you. So you do what you got to do. You perfume it away the best way you know how. But let us let you know, sis, you smell like one of them people with underarms and perfume on. We can smell it. We can still smell it. Stop perfuming the problem away and stop causing the problem. So here are the rules. Y'all are ready? Let me tell y'all something. I'm really dropping some pearls on y'all today. Y'all are ready? I'm gonna give y'all a second. Okay, just in case your little pencil broke, your little child pencil broke. Here it is. And don't argue with me. Don't argue with me. Some things are not up for debate, and don't argue with me. 1, never shampoo your hair in the shower. There's a reason why your grandmama used to bend you over the sink, lay you on the counter, bend, whatever it was. But she didn't say go upstairs, take a shower, wash your hair, and come back downstairs. No. Never shampoo your hair in the shower. Never use liquid soap of any kind. Yes, I said it. Yes, I said it. I felt the internet shock, rattle and roll, right? I felt it. Never use liquid soap of any kind. I don't care if it's made with the tears of sweet baby Jesus. If it is a liquid soap, you're going to get a vaginitis. I don't care who made it. I don't care what they say is in it. I don't care what kind of special pH balance, magic dust that they done lied to you and told you is in it. If it is a liquid, body wash, shower gel, bath gel, feminine wash, vaginal wash, any of it, you're going to get a vaginitis. Don't be taken in by the words natural, organic, or vegan. So is cocaine, but it is not good for you, just like body wash, shower gel, and any of the above. And let me give you let me just keep going before I get off track. Y'all know how I get off track. No perfume soaps. So if you're up in them folk store, BBW, come on out of there. Come on out of them folk store. Come on out of them folk store. No perfume soap, no deodorant soap, no antibacterial soap. Sis, that is bacteria for your hands and the cuts, that your superficial cuts you may have in your hands, not for your vagina. Okay? No, none of the feminine washes, none of it. None of the refreshes, the feminine washes, none of it. And since the sister sold her company, I can say that too. None of the honey pots, none of it. Summer's Eve, better. I want to hear la. I don't want to hear it. Don't even. Y'all know how I feel about boric acid. If you don't know, it's a video posted about boric acid. I've posted many videos about it. I'm a hater of it. I'm a self-proclaimed hater of it, and it is what it is, and it is, okay? Did y'all hear everything I said? Did you hear everything I said? Another thing not to do, please don't go pickling your coochie. I said it. Do not pickle your coochie. Do not sit your behind down in Epsom salt. Them people told you what it was. It's salt. Okay? Do not sit your behind in Epsom salt. If you got muscle aches, get your massage. Get you one of those little Theragun things. Do not soak in some warm water. You can do that. But do not soak your behind in any Epsom salt. No apple cider vinegar. That's great if you're taking it orally. Never put that on any cooch parts. Okay? And it's another thing. All y'all bleach soakers. I ain't got nothing to say about Big Mama. I ain't got nothing to say about Big Mama's child or Big Mama's grandchild. I'm just asking you from a gynecology standpoint, can you please not put that on your genitalia and then come in and asking me why it's dry and itchy and what I can do and can I biopsy? Please, please. It's just certain things you don't do. It's poor etiquette. Stop. Just why you jerkying it? Like you jerkying your whole coochie. Why are you doing that? You should not be 25 with dry vagina. Like what is happening here? And again, we listen, we don't judge. I'm going to fix you. But that's not the point, ladies. And I know y'all are just looking for some reprieve from these odors, but that ain't it. I stink if I don't use my Summer's Eve. No, you stink because of your Summer's Eve. And what it does is it perfumes it away for 24 hours, and then you smell fishy again, and then you feel like you need it again. Am I right? Okay. Now, there are only 2 soaps. I do not want to argue about this either. You don't want to use them, don't, sis. There are only 2 soaps that I will ever recommend. Obviously, first and foremost is going to be my Clean and Cute body wash bar. Okay. It's all the things. It's made with all the oils and the stuffs. And again, with my background being in chemistry, got into the lab, all the preservatives and all of the antibacterial, microbial, all the stuff that lives on your body, the staph, the strep, the funguses, all of that. It kills all of that. It has moisturizers in it, a bunch of different oils in it. It's all natural. And it just has a very small hint. It just smells like you're on like a tropical a shout. Like, it's just all the things, girl. But again, I'm not a salesperson. That is not why I'm here. I am not one of the other gynecologists that make you feel like if you don't buy their stuff, you're going to be sick. That is not my ministry. Before, I think I created the body wash bar maybe 2 years ago. Before I created the body wash bar for 22 years before that, it was Dove White Original. Not the exfoliating, not the sensitive skin, not the unscented, not the original, the OG, okay? That's what it was. I'm just telling you. My patients never had a problem. Now they love it because it helps their dry skin. My body wash bar helps their dry skin. It helps their stretch marks. It helps with hyperpigmentation, all the things. It helps preventing just like superficial infections. It is amazing. But again, if you can't afford it, or you can't get it, or you don't want to get it, that's perfectly fine. I don't ever want anybody to think that the only way to good health is through me, because that's not true, okay? So we got the hygiene thing down. I mean, damn, it's not as complicated as y'all will make it seem. Like y'all did I say? Listen, get in the shower, getting them folks out. And another thing I don't like, please don't use them little what do you call them? Them loofah poofer things. It's like a big net, like cloud, like the little thing that's on the string. Don't use that. It's nasty. Okay, because you wipe your whole body, wash your whole body, and then you got to wipe the crack of your booty with it, right? And then that thing got doo-doo chips, and I don't judge. Everybody don't wipe the same, and either way, you got microscopic doo-doo up there. That's why you wash every day. And then you're going to take that around the rest of your body and up on your neck. What y'all doing? Can somebody just please go to the old school and get a bar of soap and a washcloth? Just for real, just a bar of soap and washcloth. And yes, you want to be, okay. Back in the day when, I don't even know who came up with this or who said this. I think when people start having problems with the vaginitis and these doctors couldn't fix it, they said, oh, don't put no soap on your vagina or in your vagina. And then to the lay person, everything down there is a vagina, right? No. So I'm going to need you to lather up a washcloth and wash the lips, wash inside the lips, wash on your groin, wash all that, your booty, with some soap. Now, the one thing we don't want you to do, because the actual vagina is inside the hole. That's the vagina. That is where you don't put soap inside the hole, okay? But all that other stuff down there, them lips, all that, I'm gonna need you to put some soap on that, sis. Expeditiously, immediately, and with full lather. Don't be scared, I promise you, it will be okay. Okay, so there's the Hygiene. So we have Hygiene products, which are causing it, and all the black soap and all this just go off. But your vagina's like, no ma'am, no ma'am, not now, not ever, no ma'am. Okay. So we have the information about the antibiotics and the treatments and why oftentimes it's failing. And then we have behaviors that exaggerate vaginitis. And even when you get it possibly treated with the Metrogel or metronidazole, then you're going to get back in the shower with all this foolishness and boom, here it comes again. So it's like a never ending process. Now, the next part, I want you guys to listen very, very carefully. BV is not sexually transmitted. I don't care who tries to convince you it is, it's not. BV does not turn into trick. Trick is trick. BV is BV. They smell similar, but they're totally different infections, okay? But BV is sexually associated. Now, let's get into what that means. No, it does not mean your man is cheating on you. I don't know if your man is cheating on you, but BV ain't the way to be able to tell it, okay? So here's what happens. You know, they say that we're a particular pH, males are another particular pH. When you have unprotected sex, it's supposed to and come right in the middle and neutralize it. And that in the middle, that pH of 7 is water. And then that's supposed to run out of the vagina and all is supposed to be well, right? Okay, well, we know that that's not what happens these days. So people think that semen is just sperm. No, ma'am. It is sperm. It is urine. It is blood. It is pus. Okay? Everything that man does in his lifestyle is encompassed into that semen. That is, if he has a poor diet, does not drink water, always eating a bunch of Takis, don't want no vegetables, walking around with a bag of Twizzlers, popping perks, sipping lean, has medical problems, does not take his medication, is on medication, whatever the case may be, whatever his lifestyle is that prevents him from being the best version of himself, when you have unprotected sex with him, you are now the recipient of it. So it can alter your vaginal environment. And also imagine this, like if he has high blood sugar, he may be diabetic, or he may just eat a lot of candy, a lot of sugar, whatever it is. If the sugar level of his semen is very, very high, you will respond with a yeast infection. I said it, sis. So for my sisters who are like, why I keep getting these yeast infections? No, it's not tight pants that worsens it. Yeast grows in warm, dark environments, but it doesn't create it. Okay, so, you know, all the things, you cannot have appropriate vaginal health if your partner doesn't. Okay, so if you don't know that person like that and you don't feel comfortable enough asking him his history, he might not be a candidate for raw sex. I mean, again, I don't judge, but it's just something I'm throwing out there. Okay, now let's talk about my girlies who are having protected intercourse. And I hate this part of the talk because I got to big up a company that I love their product, but the company. So, anywho's, if you are having protected intercourse, let's talk about that. A lot of girlies feel like, I don't like condoms because they irritate my vagina. They do this, they do that. And you're probably not wrong. Okay, this is why the only condom that I will actually big up and talk about is B Condoms. It is a Black-owned company here in Atlanta. They do an amazing job. Their condoms do not cause vaginitis. It does not cause vaginal irritation. They have all sizes. I tell people any day, go. If he don't want to get them, he don't know where to get them, you have them, sis. If that's what we're doing, because oftentimes the lubricant that's on like your standard condoms, like your Lifestyles, your Trojans, is that the same company? No, anyway, the condoms, the regular condoms that everybody gets, the Lifestyles, the Trojans, the Magnums, I don't know, but whatever. The point is they usually have the lubricant Naloxone 9. Naloxone 9 is very rough on the vagina. It makes your vagina feel swollen. It kind of dries everything up. It makes it feel swollen. Makes you feel like you just got skid marks and rug burns all inside your vagina. So a lot of people equate that with being irritated with the condom or being allergic to the condom, and that's not actually the case. It's actually the lubricant. And if the condom breaks, that lubricant actually makes it easier to contract HIV. So I am a girly who's going to always tell you, be condoms, be condoms, be condoms, be condoms. You won't have these problems, okay? Now, another thing, since we're on the topic of condoms, and I might as well just educate you girls. Never, ever, 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 ever allow anybody to touch you with a lambskin condom. It's exactly what it says. These folk are not lying to you. It's lambskin. And so just like the skin on your face has pores on all of our face, the skin of a lamb has pores too. Pores are nothing more than holes, right? So the pores on a lambskin condom are actually larger than the HIV virus. So it may stop gonorrhea, chlamydia, trichomonas, but it is definitely not going to stop HIV. So what is the point? What are we doing? So I don't condone lambskin condoms at all, okay? So let's run it back. So between actually getting appropriately tested and appropriately treated for vaginitis, and also while you're on the medication, you cannot have sex. You cannot have sex. I tell my patients for the 7 days you cannot. If you have sex on day 6, just call me and say, Doc, don't even worry about it. Refill that prescription for me. No problem. I have no problems with it. I have no problems giving it, because it's going to spin the block and you're just going to have it again. Okay. How do you know if it's you or your partner or treatment or whatever? Normally you'll be fine. You'll be like, oh, I feel fine. I wasn't smelling nothing, blah, blah, blah. And then I had sex and then I start smelling it again. Well, girl, that's him. That's him. Don't be gaslit. That's him. I feel like we can get control of the vaginitis situation, but I feel like there needs to be a change in mentality. I get that odor is embarrassing. I get it. But I want us not to be so desperate to be ready for our partner, to be so perfect for our partner that we're running and putting all kinds of stuff up in there and all kinds of stuff. Let me just explain how deep the vagina can really get at times, right? In the space of, when I say deep, I mean anything you put in your vagina is a direct shot into your bloodstream. Y'all gotta be careful. Like, again, spin the block, go back and watch the boric acid video. Y'all really need to know this if you're a boric acid lover. You really need to know those things. But no matter what you put, these beads, these pearls, all these suppositories, all that stuff that's sitting in your vagina, it gets into your bloodstream. You know, back in the day in the 50s and 60s, when they didn't want to have alcohol on their breath, I shouldn't tell y'all this, but when you would want to have alcohol, they would soak the tampon in some things and put it inside, and they would get the same effect. Why? Because it is a direct shot to your bloodstream. So please be very careful about what you're exposing your vagina to. I even tell my patients, when it comes to feminine products, tampons, pads, chlorine free. They sell them right in the store, right next to the regular ones. Chlorine free, raw cotton or chlorine free. Don't expose yourself to toxins that you don't need to. These things that you guys are exposing yourselves to, they impact your reproductive system. They impact your fertility. You have to be very, very careful with what you expose yourself to. You know, when it comes, I'm very sensitive about vaginitis, because that's actually, can I tell y'all, I don't know if y'all ever heard the story, and I'm gonna wrap up after this. That's actually the reason I created Clean & Cube. There was a person who came to my practice to see me from another state. She heard that I was good with vaginitis. I think somebody she knew had come to me. And so she came from another state, and it was like, I don't know, like on a Friday or something, like a Thursday or Friday. She was staying for the weekend. So I treated her, tested her, the whole 9 yards. So she calls me on like Monday or Tuesday, and she's like, Doc, I knew it. It's back. The odor's back. What? I said, what? I said, come in. Come on in. I literally cleared a couple of spots from my schedule immediately for her to come in. emergency appointment, because what you not gonna do is tell me my treatment don't work. What Erica Badu say, keep in mind I'm an artist and I'm sensitive about my, okay, that's how I feel as a doctor. So she came in and I pulled her paperwork. She did not have any of the 7 types of she had no vaginitis, none. So I'm like, okay. So I said, run me through what's happening. Run me through this. So she kind of ran me through, you know, I don't have this. I take a shower at night. I don't smell anything. I wake up in the morning. I don't smell anything. I use the restroom. I put my clothes on. I don't smell anything. You know, I don't wear panties to bed. I don't smell anything. Okay. And she's like, you know, but when I go to work, I go to the bathroom at lunchtime. And after that, boom, I smell fishy for the rest of the day. And so in my mind, I realized the only thing that she's doing after smelling fishy here, but not smelling fishy all the time, are underwear. So I said, are these the underwear you're wearing today? Are these like regular underwear that you normally wear? She goes, yeah. So we always keep fresh panties in the office because we're gynecologists. So I told her to pull her a pair of panties, give her a pair of panties. And I told her to go get me some urine. And I got a dropper. Got the little dropper, dropped some urine in her panties. And I told them to dip her urine, make sure she didn't have a urinary tract infection. No UTI. Dropped some in her urine. So we're sitting there and she's about to start crying and how I was her last hope and blah, 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 blah. Right? And I told her to grab her panties after a few minutes. I said, is this what you smell? And she's like, oh my God. And so that's when it clicked. I was like, why? So she wasn't infected at all. And this is why I tell y'all, stop self-diagnosing, because you done took 20 rounds of antibiotics because you asked for them. Not because somebody gave them to you and decided you asked for them, okay? And this lady was the same way, come to find out. And I'm like, well, how long have you had these? I don't know, 3, 4, 5 years. Ma'am, why is you keeping $5 panties for 5 years? Nothing that costs $5 gonna last you 5 years. But anyway, so there's that. And that's when I I told you my background is in chemistry. And I was like, this doesn't make any sense. And she's like, I'm washing my panties. I'm like, if she's washing her panties, why is this happening? And that's when I started to research like standard detergents and what's in them and how they work. And that's when I realized they're all full of cancer causing things. And it doesn't actually release the bacteria from the fibers. It just swishes them around. The reason that most detergents are blue or green is because optically it makes your clothes look whiter, but they really aren't. And the dirt is actually embedded in the fibers. And I was like, oh, hell no. Even for myself. And I thought I was, you know, I used to use a little Ecos, a little, you know, detergent. No, ma'am. That's better than the other ones, but no, ma'am. And that's when I got into the lab, and that's when I created a preservative that kills specific bacteria. And that's where Clean and Cute came from. So that's where that detergent and then everything else kind of spinned off of there, right? How cool is that? So a patient really kind of got me seeing, understanding. But I say that to say, you know, she was so despondent and she was self-diagnosing and thinking that because she was smelling fishy that she had an infection. So never, ever, ever do that to yourself, guys. If you're smelling fishy and you're like, no, something, and they're testing and they're like, no, 7 specific tests, okay, that they should be testing for. If they're only testing for 2 or 3, be like, this ain't all of them. I could have something else. Ask, hey, can you treat me with clindamycin instead of metronidazole, please? Because this is not working. Sometimes, maybe for like 2 out of 100, maybe 2 out of 100 patient, clindamycin is going to give you diarrhea. If it does, there's a cream. Ask for the cream. If you don't, and they're capsules. They're not big, nasty horse pills. They're little capsules. You can't swallow capsules. Ask for the cream. Okay. Clear all that stuff out your pantry with all the smell goods. Okay. Shower time. Get in. You wash up. You get out. You want to spend some money? Spend it on perfume. Spend it on body oils, but don't spend it on soap. Okay. I hate to say it. I'm a little bit of a hater in that when I go to get like whatever, it used to be Target, but we don't Target anymore. But I would look in people's carts and I would go down to the feminine aisle because I'm like, well, if they got something new, the office is going to be packed next week because I need to know what's going on. I need to stay up on what's going on. And I would look in people's carts and I'd be like, I know she got an infection. And it's so bad, but you know, it's literally that predictable. So clear all that crap out. If you like, I just bought some, take it to a women's shelter. I mean, we don't want them to have vaginitis either, but something is better than nothing. And then also pay attention to the lifestyle of your partner, okay? And if you can't control what he eats, you can't control his lifestyle, all the things that are happening, he needs to wear a condom. And make sure it's B condoms, okay? So with these things that I gave you, with this information that you have, I promise you this is going to knock out 98 to 99% of the vaginitis. And if not, then come and see me, because you may have something else going on. Do you have a cervical infection? We'll get into a video about that later. But I hope this helped somebody. I hope this helped a lot of people. And just follow this blueprint, okay? Follow the blueprint. If you have to shove it down your gynecologist's throat, do it. If you're not getting what you need, go to another gynecologist. The buck does not stop. And for y'all who go to your primary care for y'all GYN, I don't know what to say. I'm just going to pray for you. Keep you lifted in prayer. You need a gynecologist, okay? It's a very complicated area, and don't think your primary knows about. Listen, I'm going to give you one blood pressure medicine to keep your blood pressure safe until you go see them. I don't know all what you should be on, because that's not what I do, okay? So yeah, anyways, so again, I hope this helps somebody. Run to drtasharogers.com and get the book, get the book. Get it for a birthday, get it for somebody who's expecting a baby, get it for somebody who's pregnant, trying to get pregnant, geriatric pregnancies. We call them above 40. Anybody who is trying to get into this realm of having a safe transition for a child here, get the book. It's on drtasharogers.com, and it's called A Black Woman's Guide to Surviving Pregnancy, Labor, and Delivery. Love y'all to pieces. Until next time, thanks for joining me.